President Obama waded into that divisive debate over health care reform today, hosted a White House summit for health care companies that might be quaking in fear at his calls for a nationwide facelift. Obama called it an historic day, a watershed event. Oh, really? But will Obama's plan to grant health coverage to the 46 million people who lack it, will it serve his purpose to bring costs down? Or will it result in only more usage and higher costs? Michael Cannon is Cato's Director of Health Policy Studies. Elizabeth Carpenter is with the New America Foundation's Health Policy Program. Let's start with you, Mr. Cannon. What do you think of the Obama plan, such as it is?
Well, there really is no plan. This is a little bit like a Seinfeld episode, what we've been watching for the past 24 hours, because the Obama administration is very excited about this wonderful consensus that these 6 lobbying associations have come to. And really all they've said is that they could see healthcare spending coming down or not growing as fast as it would have otherwise, but they haven't made any decisions about how this is going to happen. They haven't put any proposals forward. And when it comes down to it, you can bet that every one of those groups is going to be fighting to make sure that the other groups have to bear the cost of any spending reductions.
Elizabeth.
This is complete nonsense that everyone's getting so excited about this.
Elizabeth, go ahead.
Well, I mean, I guess I would take a much more positive approach. I think what we saw today was a good thing for people at home who want health care reform. I think it's a vast departure from the way the healthcare industry approached this debate in the early 90s. And what you saw is people who make money in our health system, who often make money in our health system because it is so inefficient, recognizing that our current cost trajectories are simply unsustainable. We spend roughly 1/3 of our healthcare dollars on things that don't make patients healthier. And for years, historically, these groups have opposed reforms that we know that will improve quality and control costs. And today, not only did they say bring it on, but they said we're going to help you do it. So I guess I see a positive in this today.
Yeah, Regina,
which is exactly why this is nonsense, because to believe that this is important, you have to believe that all these lobbyists are showing up saying, hey, cut our pay. We don't need it. And
I don't think that's it at all. I think what they're saying is that if they don't act now, if they don't take a proactive seat at the table, their business model and their choices down the road are not going to get any better.
I agree with Elizabeth on that, because right now, this is the time that we're actually going to get health care reform. This has been a controversial issue. It's been debated for 2 decades. It's went through its life cycle of being beat up by the press,
so why
beat
now?
Up by its opponents. It's why now is because the majority of the electorate who voted in Barack Obama voted him in knowing that this was one of his priorities on his platforms, and he's going to get it done. And this is the time that the issue is now ripe, and it will get addressed. So they're going to have to come to the table, because there will be some kind of massive health care reform adopted, and they need to either be there at the table, making sure that they're not left behind, or they're going to be left behind, because it will happen, and it will happen this year.
Elizabeth, do you think government should cap the price of health care, Elizabeth?
Excuse me, I'm sorry?
Should government come in and say, you're only allowed to charge so much for a knee surgery? Should government start capping the prices in healthcare?
That's not what they're talking about at all. I think what we're talking about...
Yeah, but that's what I'm asking you.
No. I think what we're talking about is realigning incentives, giving people who do business in our health system the incentive to deliver care that actually gives us value for the money we're spending. That's not what's happening today.
You guys
we're
are
not
so
talking
general
about
on
that
this,
at
and I got
all.
to tell
There
you, it's
haven't
really
been any
a crock.
proposals put
I think the U.S. healthcare system is one of the best in the world. And Elizabeth, you just said, for example, that when they do inefficient things, they make money. In business, when you do inefficient things, you don't make money, you lose money.
Exactly. That's why we need to change those incentives.
As long as you're insured. But if you're uninsured, it's not one of the best. If you're uninsured and you own a home, you cannot get Medicaid. That means you have to sell your home in order to get Medicaid to get health care.
All right, so why don't you zoom up and fix that for 46 million people who don't have it, instead of overdoing health care all over for 300 million? Michael.
But he's not overdoing health care for 300 million. He wants to make sure first that 50 million people are actually insured, because that's the #1 priority. And then he could create a competitive system where there's a publicly provided health care system that competes with the private sector. So at least there's a check and balance on the private sector.
I got a question, Michael. Tell me something. How is healthcare costs supposed to go down if we cover more people? When you cover more people, they use the system more and costs go up, don't they? Michael?
All this shouting is completely unnecessary because there's just no proposal put forward. Now, the administration would like to create this impression of inevitability. That's exactly what today's media stunt was about.
What has
they want to
Congress
create
and
this
the
impression that it's going to
administration
happen.
Well, it is going to happen.
There hasn't been a
We've
single
been
bill
Congress 10 days
introduced,
trying
and
to
they
clean up
can't
President
repeal
Bush's
this
mess.
reality. Now,
So
come
right
on,
now
come on,
we're
let
moving
me
on to the
finish.
next
Let me
phase and
finish,
trying to adopt
Elizabeth.
health care reform.
They can't repeal this reality. To cover the uninsured, you're going to need about $2 trillion, okay? And you either have to take that from the taxpayers or you have to take that from the industry by reducing their payments.
Michael, where's that
Every
figure come
proposal
from?
that Barack Obama has put forward for either of those, to do either of those things has met resistance either from the industry or from Democrats in his own party.
Michael.
And today's announcement doesn't do anything to obscure that fact.
It's the
This is
beginning
still
of the
going to be a
process.
huge
It's bringing
lift.
all the stakeholders to the table so we could start having a conversation to figure out how it is after 2
They're
decades.
all at the table
we still
because
have
no one
50
wants to be
million
on the
people who
menu.
are
This has been
uninsured.
debated not for 2 decades, but for 6 decades.
It's been
and it hasn't
focused on
gotten any
primarily in the
easier.
90s,
And today's
and now
media
in this
stunt doesn't
decade
make it
well.
any easier.
Sorry we yelled a little bit there. But basically, the reason they were at the table today, guys, is that it's the Sipowicz approach from NYPD Blue. You better get out in front of this. That's why they're doing it. Well, I'm sure we'll be debating this a lot more, so I'm sure you guys will be back here, I hope. Michael and Elizabeth, thanks very much.
Thank you.